you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gami because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.
Right, good morning, good afternoon, good evening, whatever time of the day you are listening to Ask the Pediatrician Hour. This is about the it's my pleasure to be here this morning to be discussing with you another important topic as regards the health of our children. Ask the Pediatrician Hour is a program where we talk about important issues that can affect the health of our children. The program is hosted by Ask the Pediatricians Foundation. Ask the Pediatricians Foundation is committed to the health and welfare of all children globally, especially in Africa, where majority of our children are survived from preventable causes. Our mission is to ensure that no child dies from preventable illnesses, and we do that through health education, information. We empower parents through all our various platforms so that they can know more about the health of their children. We promote health of children, and also we do community medical outreaches to indigent communities where many don't have access to pediatricians. And so today's program, Ask the Pediatrician Hour, is brought to you every Thursday, 10 a.m. West African time. But you can always watch the repeats from either our YouTube channel, or you can listen also on our podcast, or you can even still watch it on our Facebook page as well. So you can watch past episodes. And if you have any questions after the program, you can always post it on our Ask the Pediatrician Facebook group from Mondays to Saturday, and our professionals, our moderators, they'll be there to answer your question. Now, if you have any question about any health issues with respect to children, you can post it on Ask the Pediatrician's Facebook group. And if it's about adult health issues, you can post it on our sister Facebook group, Facebook channel, and also we have a group for first-time mothers and a lot of resources as well. You can try and contact us via any of these platforms. So welcome once again. Thank you so much for joining us. I encourage you to share this video wherever you're watching from now. Just share the link. Send it to somebody who really needs to know about important topics that relate to the health of their children. Last week I started talking about epilepsy. It was the International Epilepsy Awareness Day, and this is what we want to talk about. And one area which I didn't really uh, talk much about it sometimes strange was the myths that surround epilepsy. Epilepsy is one of those medical conditions that are fraught with so many myths, and these are the reason why there's a lot of stigma around epilepsy, and that's why the teams of these children we go to stop at the grave of stigma. That is why many people don't want to epilepsy. People don't want to speak up. They don't want to let anyone know that epilepsy, even children who have children with epilepsy. And this is because of all the various misconceptions, false beliefs, what we call myths around epilepsy. So I promised last week that I will come back and give justice to that topic because I think it's one of the most important things that we need to know. And even in Africa, for most of people, almost majority of people with epilepsy, maybe properly diagnosed, maybe they are not being treated, some of these myths are some of the reasons for why. And so it's important that we talk about it. Basically, I'm going to be talking about epilepsy myths. What are these myths that surround epilepsy? When we talk about myths, we're talking about popular beliefs that are false. I always like to talk about that when I take people on different important myths that have to be talked about children. Currently, I am listening to Facebook page and Instagram page where it's been talk about one myth that has talking about children and then it becomes based on Instagram, somebody very useful and informative. And today I just want to focus on epilepsy because we talk about it last week, we talk about what epilepsy is, and I'm just going to summarize epilepsy means the following seizures. I want to talk about seizures, seizures are abnormal of movement of as a result of discharge, in the brain. And so, and when they're recurring, we talk about epilepsy. Many people talks a lot about convulsion, which is a form of a seizure. However, convulsions where people jerk or get stiff, they're not the only form of seizures. There are seizures where children just kind of zoned out or they just stare blankly. We have drops, where children just fall down suddenly. Most of the time, seizures are something that occurs suddenly. Sometimes the children or the adults, because it can affect adults as well, they are not aware it's about to happen. And then it's not for a few, maybe seconds, a minute, and then people are back to normal going to come back many episodes in a year or over time. So that's one of the things that not to require. If you really listen to last week episode, you can go back and listen a little bit of the topic that I feel that very set for you and as well. But today we're just going to focus on what are the myths, what are the beliefs around epilepsy, that is clearly hold this stigma and that is making it hard for people or families that have children with epilepsy to know what to do. So I'm going to be talking each of those few of the myths which I will be on my website, popular ones, and then I'm going to talk about truth, the facts, and these myths. So welcome, just listening and learn and so let's start. The first thing that I like to talk about is that this is how the future when you have epilepsy. I mean, that doesn't really sound like a myth, but it is. So, like I said, you need to have recurrent seizures to really be diagnosed as epilepsy. So, having one seizure a year doesn't mean you have epilepsy. About 10% of people will have one seizure in their lifetime, which will never happen again. And we don't classify such people as having epilepsy. Also, children will have febrile convulsions. So, some children, every time they have fever, actually, I get fever because of we don't classify such children as having epilepsy as well because febrile convulsions don't stop. We don't have around 4 to 6 months and 6 years to stop. Most children will have febrile convulsions. Otherwise, they always have fever before the convulsion last. However, some students are what we call complex feedback conversions. Complex feedback conversions are students that first have lots of the conversions with one episode of feedback. Usually, most people will have feedback conversions, they just have one conversion. That was it. And that is called simple feedback conversion. If they have having repeated episodes, up to three or more, and the episode is lasting long, to more than 15 minutes, we're talking about complex seizures. And some of these who have this kind of complex seizures or convulsions or fusions will end up going on to having a called febrile seizures, which is actually what we classify as epilepsy. Remember, whenever you go to the hospital and say a father convulsion, we always ask for the children, is there fever or not before the convulsion. If there was fever, then that is seizure. And that is an issue of 6 to 6 weeks. bottom line, not every single person have epilepsy. All right. Okay, let's move on to the next myth. The next myth says epilepsy is contagious. This is one of the most popular of the myths. People are scared to help people with epilepsy when they're having the seizure because they felt if I come close to them, then I'm going to get it. So people don't want to sleep on the same bed. They don't want to eat from the same plate. They don't want to drink from the same cup. They don't want to even, if possible, stay in the same space, like in the same class or in the same house or room with somebody with epilepsy because of the fear that I'm going to catch the epilepsy. However, I'm happy to inform you that epilepsy is not contagious. Epilepsy is not contagious. So helping somebody who has epilepsy, trying to clean them up after a if they have a seizure, or helping them turn to the side, whatever you do will not lead you to you catching epilepsy. Living the same house with them or drinking from the same cup, sharing some things will not make you have epilepsy. So please, let's learn to show love to people with epilepsy because it is not contagious. Epilepsy is not an infectious disease. It is not one of those like HIV or Ebola or coronavirus in where you have to maintain social distance and all that. No, no. Epilepsy is not contagious. So please do not be scared to assist someone, especially maybe in school or in the womb, that can lead to epilepsy, or children who didn't cry at birth when they are born, and because of that, anyway, there's a time when we consider doing workshop, the time when we workshop, sake. And later we actually discovered some of the babalawos actually were grinding seizure medications and adding it into those powder they were giving parents. This is true story, because they also know that there's really nothing they're giving you. So they figure out how to get the real anticonvulsants and give to parents because they want to obviously defraud parents of their money, by trying to find a solution. Because if they don't obviously find a solution, you won't come back. All right. So bottom line, epilepsy is not spiritual. Okay, epilepsy has to do. It's a physical problem with the brain. We sometimes know why. No seizures, we gradually begin to tail off the medications. So please seek medical help. I did tell a story last week of somebody, because people don't know that this is just purely medical and there's help. They just keep running from pillar to post, hiding the person away, and the quality of life will be so poor. And immediately they get the right help, everything was over and their life, So this is something that at least we can help. And when I was looking at the statistics just before this program, I found that in Africa, 75% of people who should be on medication are not, either because they don't come or they don't have the money, and or they don't believe that this is something mixing. There's a lot. It's very common in Nigeria, in Africa, for us to hear, "Oh, this is not a medical problem, or you need to go to you need to go spiritual." Yeah, that is the word. You need to go spiritual on it. And I really want to call out Nollywood, our film industry. Thank you so much for putting Nigeria on the map. But please, you are not helping us in terms of medical issues. So let's stop all this, our film, telling people they've been to hospital and telling them, this is not especially people that have seizures in movies, and they start bringing out the foam and then they take them to the hospital, and then it is the doctor. Yeah, it is the doctor that will be telling them in the movies that this is not a medical issue. You can go spiritual on it. No, all those things is not right. It's not helping our people, because people take those things they believe it and they think it's actually true. Please seek the right doctors, not Nollywood movie doctors that are always telling you to go spiritual. Seek the right doctors. Epilepsy can be treated. They don't need to bring out any lizard. Right? Let's move on. People believe that another popular myth, very close to the one that I think is no, no. I know that in Africa, we do have some know, you know, there are some kind of what we call complex partial seizures that can make people with epilepsy behave funny, uh, but it's still a seizure because you will see that it starts suddenly and it ends suddenly. It is not like a perpetual state that they are in, unlike people who have mood disorders or those who have mental illness. Epilepsy episodes are usually very, very separate. It has a beginning, it has an end. So just to let you know that epilepsy is not a mental illness, and it is not. Um, it does not mean they are emotionally unstable, and even if you are being treated like the adults by a psychiatrist, that doesn't mean you are. A lot of very intelligent people who can have epilepsy. Of course, there are people who have learning disability or intellectual disability, and they also have epilepsy as additional medical condition in addition to their um, disability, intellectual disability, but it does not mean it is epilepsy that is making them to have intellectual disability or that is affecting their intelligence. So there are people who are intelligent, who are smart, and who have epilepsy. That it has nothing to do. But some people who have very severe brain injuries, malformation, because there's so much part of the brain affected, they can have both the epilepsy and the intellectual disability or global developmental delay, like we do use in children less than 5, coexisting, but it is not a cause and effect. So it is not the epilepsy causing the learning disability or intellectual disability. It is something that can coexist, but majority of people with epilepsy they have normal intelligence, so it is not that. But let me quickly also say there are some medications that when people use it for epilepsy, it can lead to it's one of the side effects is affect the cognitive ability. So which is one of the reasons we don't like to use those medications, especially in children. So people, especially in Africa, everybody, if they don't go to hospital and you go to chemist and you say your child is having seizures or convulsion, they just give you phenobarbital. I mean, I've seen a lot of people say I'm taking phenobarbital. No, usually we don't like to use it in this age now. We don't want to do for the next year. Sometimes we need to just feel like we just don't want to take this stuff and we do it to the old place and we need to do it and go and do it because it can affect the cognitive ability. So that's what I'm saying. So people say I'm just doing it to that. No doctor is studying, is studying, and they just need to do it to that. And the doctor will be who doesn't have no control when it comes to children in the next 20 overall, epilepsy itself does not cause low intelligence, and people with epilepsy are smart. They are intelligent just like any other person. So let's get rid of the myths. All right, so let's continue. We still have a lot of myths I'm going to get through today. Another myth is that people who have seizures can handle high pressure, demanding jobs. And I think that's a message for parents. Sometimes parents are very, very protective of their children. And if a child is having seizure, epilepsy, they are very, very protective of them. And they don't even want them to do anything. They stop them from doing sport, they stop them from doing this, they stop them from doing that. Most of those things are not necessary, really. There's really no need to be restricting, sorry, the life of that child just because they have epilepsy. They just need to be treated, all right? They just need to be on their medication. Of course, common sense, there are some things we say if they are swimming, we just want to make sure there's somebody around, okay? So that in case there's any emergency, there's somebody there, the lifeguard, or at least somebody is around, but that doesn't mean they can't go swimming. Or sometimes we say kitchen, like when they are in the kitchen cooking, we don't want them to be the only one in the kitchen cooking, just in case they have a seizure and we don't want them to suffer burns. At least there's somebody there, we can quickly make sure they are protected. But we try not to limit the life of our children because they have epilepsy. Let them live their normal life. I think that's one of the myths I'm still going to address. And for adults, it's also the same. Adults with epilepsy, well controlled epilepsy, they can live their normal life. All right, so there are some jobs that we try to say for you before you can do those kind of jobs, you need to have clearance from your doctors. For example, like driving. So maybe different countries have different policies. Some will say you have to have been seizure free for 1 year. It doesn't mean you won't be able to drive, but we just want to make sure you are well controlled, and then you're not going to have an accident, a seizure while driving. Of course, you're going to put yourself and other people at risk. So there are some kind of policy in place. Maybe you have to be seizure free for 6 months or 1 year. Different countries have different policies, but the bottom line is that having epilepsy does not mean you cannot do any job. It does not mean you cannot do high pressure job and all that. You can do anything you want to do. We just have some safety guidelines around certain things like swimming, like cooking, open fire, and things like that. That is just safety, and making sure you're safe. But otherwise, the epilepsy itself does not stop anyone from doing what they want to do. All right, let's move on. Somebody said some myths is like it's easy to tell when the situation is about to happen. Like I said last week, it is not always true. Sometimes people have what we call aura. They have an idea. They start feeling certain things when the situation is about to happen. Actually, those people have what we call primary with secondary generalized seizures. So the aura is more like the initial sign, and then before they have the full seizure. But most people with seizures actually don't know when it's happening. It just happens suddenly and it ends suddenly. So they can't predict when it's about to happen, so especially if it is generalized seizure. If it is partial, sometimes they are conscious, they are aware what is going on, they may not be able to stop it. But sometimes because they know what's going on, they can manage it a bit. But most children who are going to have epilepsy or seizure, they won't know when it's going to happen. It just hits them suddenly and it stops suddenly. So don't think people are faking seizures or they try to have a seizure for maybe a monetary gain or for a particular gain. No, not necessarily. Most of the time, they don't know. All right. Another myth is that seizures are painful. So people believe that seizures are painful or they hurt. Actually, for the generalized seizures, most of the time, the children or if the adults, they are not aware what is going on. So they are not feeling pain. And because these are some of the things that make parents to be um, apprehensive, like, oh, my child is going through a lot of pain. And I know most parents we don't want our children to go through any form of pain. I mean, which is quite commendable. But you can rest assured that most of the time when they're having seizures, they are not having pain. However, after the seizure episode, depending on what happened, like if somebody, if they drop down on the floor, they hit their head, or they convulse for so long, jerking for so long, of course, they will have, like, after effect of that can give them muscle pain, or if they've had injury where they are having the pain. So when they're having the seizure, then they can have. One week is don't always think that we can do that. So, I think this is someone who is very young and very urgent. So, I need to so, it's not only children that have epilepsy, adults also have epilepsy, any age, any gender, any social class, anyone so with children with um tend to be clinic group to explain of the university that very good and most commonly affected or epilepsy affected anyone. So when epilepsy affects adults as well. All right. Next step means is that this is a very popular one that children or adults or whoever is having epilepsy, they swallow their tongue or they choke on their tongue. And it's really, for those of us in Nigeria, it's very common. People always want to do something about the tongue when people are having epilepsy, as if that tongue is the most important thing during epilepsy. Now, the worst that can happen during epileptic seizure is that they can bite on their tongue and then they can suffer injury, laceration to the tongue, but they don't swallow it. Okay, and they don't choke on their tongue when they're having seizure. So there's no need to be too focus on putting something so that the tongue or the teeth will not clench together, that which is what people actually in some parts of the country believe if the teeth clench together the person is going to die. That is not true. All right, that is not what kill somebody who is having epileptic seizure. What will kill somebody who is having a seizure is if they can't breathe and if oxygen is not getting to their brain, whether their teeth clench together, whether the tongue is in or out. That is not going to cause any. So they don't swallow their tongue, they don't choke on their tongue. It's not going to kill them. All right, their teeth clenching together is not going to kill somebody who is having epilepsy. All right, so there's no need to be too worried about the tongue. The worst that can happen is that they can bite on it and then it can uh cut their tongue, have laceration of the tongue, but they don't swallow the tongue. So let's not worry about the tongue. All right. another myth that which is very contributed to the mouth community that you have to do something with the mouth. Maybe one of the things that we do is to do that if you talk about the first stage, so when you should not do after as important as when you should not be able to do anything in the world. Don't put the phone, don't put don't put someone to all those things that if you try to do this and that thing, if there's something taking the joy, if there's something taking the taking the taking the passing the thing to you and make that don't put anything in the tongue, in the mouth of somebody who's having epilepsy. Don't just don't. So one of the key um, principles in medicine is first do no harm. It's one of the ethical principles when it comes to medicine or medical care. In other words, don't if you're not going to do any help, then don't do any harm. All right. So if you don't know what to do with somebody who is having seizure, please don't do any harm by putting anything in their mouth. Just leave them alone. Just it's better to just stand doing nothing than to cause more harm. So first, do no harm. Don't put any steak in their mouth. And before I leave this particular meat, there are many other things people also do that they should not be doing. Please don't burn their hands in fire. Don't put their hands and their legs in fire. I see that a lot. When I was in Louth, there was one of our patients that had or if you don't do what you do, don't stop. So don't put any tight hands and legs in fire because it will last. All those were things that were iatrogenic, caused by people on their own. Decided to look at that thing, this is just what they have to do. So at the end of the day, we still putting malaria in 3 days, but we're still treating the cause caused by silver sickness. And so please do know how. Always remember that. Do know how. Always do know how. Don't put yourself into trouble. Don't put salt in the mouth, in the nose. Don't put palm oil anywhere. Don't do that. Onions, don't. All those things we do nothing. All right? The person saying let's get it happens to people is to make sure they are safe, that they don't hurt themselves. You cannot stop the people that stop. People will stop and will nothing those people will stop within next in other words, the most important thing you need to do is to make sure that that person doesn't hurt themselves when they're having a seizure. So you want to remove anything around them that can make them hurt themselves. You want to make sure they just, they are safe. They are not banging their head on the pavement or on the floor or anything that can hurt. Do not put anything in your mouth. Do not put a hand in fire. Do not put salt. Do not put oil. Do not put spirit. Do not put spirit and fire. Do none of these things. Alright? Please just let them be because I think it has more harm than good. I think it all the things I think you need to do to the dentist. I think too much money. I'm not taking it. Please do not do that. Okay. Now let's go on. We need to talk about people can be controlled, can't be controlled. What do you do that? Epilepsy is not something that can be controlled. For one, I'm happy to tell you epilepsy is a big disease. We have about 20 different drugs and more having that we use to treat it. Most of our people in just one control. Epilepsy is something many of them have taken up the medication and they are having seizures. Alright, every day I'm testing another member of family that have been almost 2 years now. I'm testing this stuff. Epilepsy is one of those things. It's like HIV that we don't have a cure. Epilepsy is one of those things that we have. Of course, we have some what we call very difficult to treat epilepsy. It's something that we treat treatment, finger stimulation, and all that, but they are not the common ones. They are not the majority, of the epilepsy. Majority of children with epilepsy, we can treat them well. So don't think, oh, I'm wasting my time going to see doctors. One of the things I like to let parents know that when you start treating epilepsy, please be patient with the doctors. When we start treating epilepsy, we don't magically know what drug your child is going to respond to. Number one, we can suspect that maybe this will be better based on the kind of what we see on the EEG, semiology, and all that. We can suspect and we can start those medication. But for one reason or the other, some children just don't respond to a particular drug and some respond to a different drug. So sometimes we have to do a bit of trial and error to know what your child is going to respond to. Sometimes we have to start with a particular dose and then gradually work it up till we get to the dose your child is going to respond to. Sometimes the seizures will start reducing, they're not going to stop immediately. Okay, so this is how it works. One of the things I normally do is that for the first 1 hour before I start your child on medication, I'm talking to you because I really need you to understand. Because some parents, you start their child on medication, the following day the child has seizures. Oh no, that doctor doesn't know what she's doing, and they are off to the next person. And maybe that is when people say, oh, this is not a hospital case, so this is spiritual. And then they will stop medication, go spiritual, and then yes, the child is still having seizures. Whereas if they have been patient for us to take the child through the trial of the drugs till we get the right dose, till we get um the right type that work for your child. Some children will start with one drug, we go high, it's still not working, we stop, we start another drug. Some children we have to give them 2 drugs. Some children we have to do 3 drugs. Some children we have to think maybe ketogenic diet. Some children we have to do some. There are different options. But please, please, please be patient with the doctors, because this trying out new drugs, we can't do it in one day, we can't do it in one week. We do this since over months. So that is why the doctor will keep giving you an appointment. Please attend your follow-up appointment. Please be patient. All right. We have over 20 drugs that we can try. So you can imagine. And we have to make sure we try. Well, some drugs will be working and the child start having horrible side effects, and we have to take it off, because it's not just decision stopping. We don't also want to have side effects. And these medications are not um, uh, very that's the point I'm making. Person, a lot of people just want, it's not like malaria that we people just in 3 days and everything is covered. No. When you're dealing with epilepsy, you're dealing with something that you're going to do it over months and years. So you need to do it regularly. Sometimes you're very lucky, you start the problem with one. That's the last time you got it. We are happy, we are happy. But most everybody is going to have that things and things. Some people will do it try name for them operate and get to the maximum return of things that we could try and then try this and then we get that work. But please, we need to understand. One of the things we normally do is we give you booklets, we give you leaflets explaining epilepsy. We ask you to join parents support group. We give you a seizure diary, so you can always write it for us, and then we can see, oh, this seizures is getting better, then that means this medication is working. Oh, it's not getting better, it's even getting worse, then let's try something. And sometimes we want to try a new drug, we have to gradually first take off the old one before we start the new one. So it's not going to happen suddenly like that. And even when the child is no longer having seizures, when we want to stop the drug, we don't also suddenly stop. We have to gradually take the drugs out of the child's system. So please, we have made treatment for epilepsy, but please be patient with the doctors. And if we think it's something that is difficult to treat, most time we refer you to the super specialists, and those are the ones that will decide whether it is surgery, is some treatment that are not so common, but you have to be patient with your doctors. Don't quickly run away and say, oh, they don't know what they're doing or it's not working. You have to be patient. All right. All right, let's quickly round up. Women with epilepsy should not get pregnant. This is another popular myth. No, this is not true. Women with epilepsy can get pregnant and they can have children. However, there are some medication we don't give to women who are going to get pregnant. Okay, and if you are already on that medication, we may need to stop it. For example, sodium valproate. It can cause abnormalities in the womb. We don't like women who are likely to get pregnant. We don't like to get pregnant women who are pregnant. So we try not to that we can do to so having a pregnancy we can get pregnant when we have children. But please, if you're going to get pregnant, look at our future, those who are also sexually active, you may have to do some contraceptive. You can go to get pregnant when you are doing some medication. So if you let us know, we will stop the drug and we can give you one that is compatible with pregnancy. So that you can carry the baby for so I told it, okay, another popular myth that is not epilepsy, you're going to have to very popular in Africa. And people even do what we call when somebody is going to get married, they actually do a kind of genetic history findings and all that, because they feel like, oh, epilepsy runs in this family, and likely, so we don't want our daughters to get married into a family where they have epilepsy. The truth of the matter is there are genetic epilepsies. Yes, it's true. There are epilepsies that can be passed from one generation to the other, but not all epilepsies are genetic. Okay, so for example, if a child has meningitis or encephalitis, a brain infection, and that leads to complication of epilepsy, you're not going to pass that on to your next child who doesn't have meningitis so that's not going to be passed on. If epilepsy is due to malformation in the brain, you're not going to pass that to your child if your child does not have malformation in the brain. So majority of epilepsy you can pass it on, but a few, yes, they are genetic and can be passed on, but they are not the majority. So you don't have to be scared that, oh, I don't want to have a child because I'm afraid I'm going to pass the epilepsy on. Most time you're not going to. And our genetic doctors can help you, and they can test you, and they can let you know whether it's the type that you can pass on or not. And even if you have a baby, they can also decide, do you want us to test your baby and all that. But most of the time, it's not like that. All right. Another myth is that you can't live a full normal life with epilepsy. I think I've already dealt with that thoroughly. You can live a normal life with epilepsy. Your epilepsy can be treated. You can stop living with epilepsy. Another myth, people with epilepsy cannot walk. Again, that is a myth. A lot of people with epilepsy are walking and they're doing what they like. Another myth, people always lose consciousness when they're having epileptic seizures, or they always have to convulse. Again, this is due to lack ignorance about what epilepsy is. So that it is not every seizure that you check. It is not every seizure that you convulse. It's not every seizure that you drop. You become unconscious. So some seizures you can just sit there and just be gone. Even as I'm talking to you, you see me stop and then suddenly I pick up again. That's a seizure. So there are different kinds of seizures. So it's not everybody who is getting medication knows that there are not people that have epilepsy that don't so some people don't know exactly if you have a seizure or actual epilepsy, you have to know it's going on. So just to know, epilepsy is not one condition. I know most people are familiar with the checking because that's a dramatic one, where you start checking your phone screen and your phone, and then some phone is coming out of your pain, your body, or your passing through. That is what most people are familiar with. That is what real kind of seizure. There are different kinds of seizures that do require directly cognitive kind of presentation or program. Um, Another very popular myth is that when somebody is having seizure, you need to stop them, you need to scold them. I think a lot of mothers do this consciously or unconsciously. When their children are having seizure, they just grab them and hold them. No, that is actually wrong. Wrong. You don't need to restrain anybody who is having epilepsy. I think I really mentioned that when I was talking about what you should not do. Another thing, apart from not putting anything in their mouth, not putting all those other things I mentioned, please don't restrain them. Let them have the seizure. You can't stop the seizure by holding them. It's going to happen, all right? It doesn't stop. If you can stop somebody from having a seizure just by holding them, it is not a seizure. It is a pseudo epilepsy. They are pretending. Okay, so somebody who is having full blown seizures, you can't stop them from happening just by holding them, all right? So just leave them. Again, just leave them safe. Another popular myth that epilepsy is due to flashing light, like connecting TV or your phone in your computer. So there's what we call photosensitive epilepsy. Okay, so there are epilepsies that are triggered by light flashing and all that, but that is not an epilepsy. Most people don't epilepsy are not triggered by these lights. So you can learn it, if you are familiar with it, so it's anything you do every day after the stimulation, you shine the light, and if you want to see whether your child or whoever that is, you have an epileptic seizure, which you can see in the body because of the flashing light. Most of the time, most people have epilepsy. So if you see all epilepsy that they find out that that's triggered by flashing light. So there's no reason to feel it. Don't just TV, it's going to make you have a seizure. No, if your child doesn't have a photosensitive epilepsy, you don't need to put them on that restriction. All right, our time is running. Um, Okay, I think I've already talked about people having seizure and you putting things in their mouth. Please do not put anything in their mouth. And I think I will stop the myths there. Of course, there are so many myths. I'm sure if I ask those of you who are listening to send me what popular myths you've heard about epilepsy, I'm sure you'll be able to send it to me. So, but the reason why we have to talk about all these myths is to let you know about them, and you can see some of them can impact in terms of stigmatization of people with epilepsy. Some of them it has to do with wrong approach to treatment, and some of them can lead to other complications. So this, which is why it's so important for us to know about the myths. But before I leave, I really want to talk about the first aid in epilepsy. All right, because some of the myths I've talked about has to do what you do when somebody is having seizure. It is so important to know what to do. But like I said earlier, if you don't know what to do no harm. All right, do no harm. So I'm going to share a picture for those of you who can watch, and for those of you who are listening, I'm going to talk through it as well. Again, most of the epilepsy that you will notice are the what we call the convulsion type, where people are actually fainting, they're jerking, they're going stiff and all that. Those are the ones most people see. The other types, most time you don't even know what is going on around unless the person tells you they just had a seizure. So the most important thing for somebody who is having seizure is like you can't stop it. He's going to stop on his own. But please keep them safe. If you remember that, that's all you need to do. You want to keep them safe. You know, somebody, when people is jerking, they fall, they can hit their head, and sometimes they can suffer head injury from that. So we don't want them to hit their head. So you can just make sure that wherever they are, they're able to put their head on a surface that's not sharp, not rough, not like a concrete floor or anything. If there's a concrete floor, you have to put like a cushion or something around. We don't want them to have an head injury. That's the most important thing. Then we don't want them to strangle themselves. So if there's anything like chains or ties around, their neck, you need to remove it. Again, it's about making sure they don't have any tight space, tight space. Anything around the neck, you remove it. Then turn them to what we call recovery procedure. Because you know what you can say. But just turn them on the left side, basically. Put them turn on the left side. Right? Then if there's anything coming out, saliva and all that, it is coming out, it will go back. Because if the light on the back, then it can go back and it can show from the volume of the saliva. So just turn them to the side. So it makes pushing the hair, make sure that whatever setting the light on is not too hard, sharp setting. Using any tightness around the neck, turn them to the side, put the saliva, whatever is coming out. Please do not put anything in the mouth. You need to put the side. Not something just to grab food, spoon, whatever, and put in the mouth. Please, there's no need. And there's no need to say, oh, let me help them bring out their tongue. Let me have them. No, they're not going to choke on their tongue. They're not going to bite. They can bite on it, but that is fine. But please do not put anything in their tongue. Do not restrain them. So remove any tightness around their neck, turn them to their side, and watch. You can time the seizure. Check your time and see how long it's going to last for, but do not hold them and all that. Then, if in 5 minutes the seizure has not stopped, please call for the emergency service, call an ambulance, take them to the nearest hospital. If they have an ID on them or something, you can use that to call maybe their. Usually, people who have epilepsy, we always tell them to have this emergency contact or badges, or if I am having seizure, this is what you should do. This. Sometimes they have it on them. So, but if you don't have that, just call them, take them to emergency. That is all you need to do. That is all. It's as simple as that. There's nothing else you can do. Do not try any treatments. The only treatment for somebody who is having epilepsy should be when they are in the hospital. And I think that's on that note, I'm going to end to this presentation. Thank you so much for listening. If you have any question about epilepsy or the myths around the epilepsy, or you have a myth that you want to run by us, please send it to me either via my email, drbimisola@askthepediatricians.com, or you can go to our Facebook group and you can post it there. And I really want to plead with you to share this video, because like you would have noticed, most of these myths are quite common in our setting in Nigeria and Africa, and we really need to stop all these things. We meant well, we want to help, but sometimes trying to help will cause more harm. So, which is what we don't want to continue. Remember, do no harm. Remember, do not stigmatize those who have epilepsy. Remember, epilepsy is a medical condition, it's a physical health issue, and it is treatable. So till I come your way again next week with a fresh episode, talking again about something important about the health of our children, I want to say have a wonderful day and bye.
Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Bami, because it's informative, educative,